During his 41st COVID-19 public briefing this week, Namibian President Hage Geingob announced that the wearing of masks in public places is no longer mandatory. This comes amid a decline in positive COVID-19 cases, hospitalizations and deaths. The president also increased the number of people at outdoor gatherings from 500 to 1,000. Those fully vaccinated no longer need to produce a negative PCR test result to travel in and out of the country. And Namibia has seen on an average of about 14 confirmed cases over the period of 7 days, with only 222 positive infections as of Tuesday. We'll be speaking to Namibia's Minister of Health and Social Services, Dr. Kalumbi Shangula, regarding this. Namibia, of course, will be testing this only for a month. It gets underway from the 15th of April, and it will, rather 15th of March, and it runs until the 15th of April 2022. This, of course, is just a drop in the releasing of the COVID-19 protocols. The Minister is on the line. A very good morning to you, Minister. Thank you so much for your time this morning. A pleasure to be talking to you. Big movements made by the President in this regard. Let's quickly talk about how well Namibia managed the COVID-19 pandemic.
Well, thank you very much. I'll briefly tell you exactly what happened in Namibia, and I also want to make some correction as to what was stated concerning the masks. Well, Namibia have gone through 4 waves of COVID-19. The worst one, which we experienced in June, July last year, which was driven by the Delta variant of the COVID-19 virus. Well, our initial response really consisted of informing the public what the disease is, how it's spread, how one can prevent infection. So that message was driven home. Obviously, as time went on, we started getting more cases. So the government took drastic measures to protect lives, which include the announcement of the state of emergency on the 17th of March 2020. That was followed by lockdown of specific hotspots, and eventually the whole country was under lockdown. Also, curfews were imposed, and that way we managed somehow to avert major catastrophe, because a lot of infections were averted, and a lot of deaths were averted. Currently, we emerged from the 4th wave, which peaked on the 19th of December 2021, and we are now seeing less and less cases on a daily basis, average around 14 cases per day. And there were instances when we get less than 10 cases per day. For the past 10 days, we haven't recorded any death due to COVID-19. Yeah, so that is currently the situation. But the measures we have taken, apart from what I have enumerated, is also that we had managed to vigorously test the populations. And currently our test rate is 390 per 1,000 population. So this is one of the 3 highest testing rate in Africa. That also includes South Africa.
Now, Minister, the numbers are looking very good. They've dropped drastically over the last few weeks. Why was it so important to implement these changes as soon as possible in terms of the national priority interventions?
Well, we have always been guided by the epidemiological profile at any specific moment. And we have also employed statistical modeling to predict what is the likelihood of the trajectory of infection in Namibia. As we are seeing fewer and fewer cases, as the situation improves, let me start it from the fact that we have already ended the state of emergency in 2020. And then after that, we have also ended the curfew as the situation improves. And currently, because at the beginning of the pandemic, the wearing of masks was mandatory and it was enforceable. If anybody is found in the public space, can be arrested by the police and fines can be imposed. So it was actually a criminal offense not to be wearing masks. Now, as the situation improves, as we have done with all other measures like the state of emergency, the lockdown, the curfew, we also saw fit now that it's time to decriminalize the wearing of masks. It does not mean that we have scrapped the wearing of masks. It simply says that we have decriminalized the non-wearing of masks. This is also informed by the fact that the public has been with the pandemic for the past 2 years now. They have internalized the messages. They know what works. They got used to wearing the masks. So it is felt that now people can then internalize that message that they have to wear the mask all the time. So the wearing of mask is not scrapped, but it's left to the evolution of the individuals because they have internalized the message that wearing of mask protect them against the infection without being forced to do so.
No, Minister, you mentioned the fact that it's decriminalized, not scrapped. So if I understand you correctly, you're putting the onus on the citizens to take it upon themselves to ensure that if they're in a space where there might be poor ventilation, masks should not be worn. Just two questions from that. Am I correct in saying this is for outdoor only, or is it also indoor? And according to the measures that have been put in place, Minister, it says that within public transport, indoor and public meetings, where some of the attendees are not vaccinated, then the wearing of masks is encouraged. Is there policy at all to enforce this, or if it doesn't happen, it just doesn't happen?
Well, we look at it this way. Now, let me give you an analogy. If it rains and you are outside, you know that you have to use an umbrella to protect yourself against the rain. So in that instances, one would not expect the government to legislate that anybody who is in the rain when it rains must put on an umbrella. But people do so at their own volition. The same should apply that, we are still in the pandemic. It's like we are still in the rain. And therefore, you put on your umbrella when it's raining, you put on your mask when you are in the pandemic. So that is basically the drive, to say that individuals must take responsibility because the government cannot always continue to police each and every individual.
Now, Minister, there's what has been said, there's a fifth wave looming. We're entering the winter months. We know that that is generally the time when there's less ventilation and, these viruses can spread a lot more rapidly in those times. Understanding as well that there's a small cluster of infections within the schools. How then do you manage that if you've removed the state of emergency and if you've decriminalized wearing masks? I understand the analogy you've just made, Minister, but also to some extent, some people might say, well, I don't really have to wear a mask in any case, whether I'm feeling well or not.
Yes, you are right. In any instances, you will always find individuals who do not conform. But we are confident that the majority of people, as we have observed for the past few days after the announcement, people are still continuing to wear their masks because they understand the importance of wearing masks. So it is not really much of an issue for us here. And I must also maybe add here to say that our measures, our intervention, they are always informed by the epidemiological profile. There were instances, for example, in the past when we have stopped the lockdowns, but when the situation worsened, we reintroduced the lockdowns. The same happens with the curfews. And I also want to assure you that if the situation demands, we will take the appropriate measures in order to protect the life of the Namibians, which may include, if it's warranted, the reintroduction of mandatory wearing of masks, etc. Now, when it comes to the school, as you have pointed out, we have made a strong recommendation that in all indoor settings, people are encouraged to do so. They have been doing so, and we are confident that they will continue to do so.
Let's look at the positives coming out of this, Minister. What are you expecting this to do for the country, the people, the economy?
Well, this will have a positive spin in that when there is much more freedom for the public, then they will resume all economic activities so that they will revive the economy, which has been really battered by the measures introduced as a result of COVID-19. And this will also give the public some confidence that although they have borne the stringent measures against COVID-19, there is still, this was done in the interest, and the government is apprehensive of what's going on as far as the economy is concerned, and is lessening up, doing some relaxations so that economic activity can resume and the economy can be revived.
If you look at the vaccine rate, Minister, about 25% of Namibian citizens who are of age to be vaccinated have received at least one jab. At least that was according to the latest stats that I could find. However, also looking at the amount of infections compared to how large the population is, I mean, only 158 or 57 odd thousand infections from a population of over 2.5 million people. Are you putting some of the science that you speak of on the fact that maybe it's a herd immunity achieved through previous infections, or what is some of that science? What does some of that science tell us?
Well, we know that COVID-19 cannot be prevented by one intervention only. And that's why we have a combination of interventions that includes social distancing, continuous sanitizing, vaccinations, and many others. Therefore, it's true that we have a very low vaccination coverage. Number one, we started a bit late because it was very difficult to access the vaccines. And currently we do have some supplies. And the vaccination campaign is still continuing. And people are still coming forward for vaccinations. And through vaccination alone, as you mentioned the statistics, about 1/4 of the eligible population of our adult target population and child target populations, they have been covered. We do also not exclude the fact that many people have experienced instances of COVID-19 infection, and some of them may not even have known that they were infected. There is also some degree of natural immunity arising from those infections. So although the figures which is protected through vaccination may look low, in actual fact, we might have quite another large number of Namibians who have been protected through natural immunization due to the fact that they have experienced instances of COVID-19 infection.
Minister, thank you so much for your time this morning. That is Namibia's Minister of Health and Social Services, Dr. Kalumbi Shangula, making time for us this morning. Those measures will be implemented from, or are implemented from the 16th of March till the 15th of April. Up next.